Everybody, it's Dr. Angela Cudger with Legacy Holistic Health Institute. And today I have someone with the amazing at technology and significant background. Today, we're going to be talking to Dr. Diego Salinas. He is the co-founder of Vibely, which is a coaching platform that we're going to talk a little bit about today. How are you today, Dr. Diego?
I'm doing well, Angela. Really excited to be here. Real honor to work with you today.
Awesome. That you to join and be a part of this evolution of health coaching. For those of you who are watching, make sure as you jump on here, you let us know who you are and you let us know what it is that you actually do and where you're from. And so today, we're going to be talking specifically about how technology can innovate healthcare and how coaching is a huge part of adding value to a patient's experience. So, Diego, I want to hear a little bit about how you've been in the healthcare space and then how you evolved into the health coaching space.
Yeah. So I found coaching, to be honest with you, very accidentally. And so I'm really passionate about spreading the word what coaching is. And so I remember I did first neuroscience undergrad. I'm curious how the brain works and neurocognition. Went to medical school and studied pediatrics. And speaking of systems-based care, the child is a system amongst the family there. And I remember towards the end of my residency programming, I was seeing all these issues in the healthcare system, right? I was even seeing myself turn a little more cynical. And I was thinking, you know what? No, that's not who I am. I remember talking to my director at the time. And I said, hey, given there's all these problems in healthcare, instead of being cynical about it, I mean, that means there's more solutions we can create. I said, given that, my personality, my passions, my love of people and connection, bedside manner, how do you see me plugging in some of those holes, moving that needle forward a little bit? And I'll never forget her answer. She goes, Diego, I know you're passionate, I know you're caring, it's lots great and all, but it's a big system. It's a David and Goliath thing. Just get a full-time job and see what happens. And so I remember walking out of her office and in that kind of fluorescent hallway, I'm kind of looking down, pensively thinking, I'm like, wait a second. Firstly, doesn't David win that fight? I was like, but even if he didn't, I'd rather kind of die trying, throw those rocks, right? I don't want to give up on my dream of making the world a better place. And in pediatrics, I saw, I was really interested in hospital work, but also a lot of different things, how things came together, endocrinology, nephrology. But I saw a lot of the issues that were actually plaguing kids and families weren't necessarily diagnosed in the medical chart. They were lack of knowledge or awareness. I'll never forget this one family came into the ER. This mom with a 10-day-old was like, doctor, my son is dying. He's stooling. She had diarrhea. It's normal baby stool, right? And so and she had seen 4 doctors in 2 days, right? And I got yelled at for spending too much time with my patients. And I was like, this is not right. And I was like, I know, I love education. I love teaching people. What if I focus more on the educational part of healthcare? And as an example, all of my friends, when they go to I had a friend who went to the ER. He's like, Diego, I went for chest pain. I don't know what happened. I was for 5 hours. I was like, okay, this is my opportunity. I can help educate people. And that can maybe fill in that gap, avoid these anxiety and distress and the energy spent and the money spent and the resource allocation. So my initial thought was to create a program called Pediatrics for Parents, Peds for Parents. I heard this phrase one time. Someone said, a fellow colleague, I want people to think of me as a medically educated friend, that friend that you call after the ER visit, right? I was like, okay, I'm going to do this, right? And I was in Durham, North Carolina at the time. And someone said, hey, someone told me this Duke health coaching program. Why don't you take that to do that teaching thing you want to do? Because I was like, how do I teach? I want to say, I'm a doctor, but I'm not your doctor, right? Like, how do I want to talk to the families without the kids around so they're not distracted? Because as much as I want to talk slowly and sit in the bed with you, if the machines are going off or your kid's crying because they're vaccinated, it's a hard place to really listen. So let me create an environment that's more conducive to learning. So I was like, great, I'm a big nerd. Let me go learn at this Duke health coaching program how to teach better. Fantastic. I love taking more courses, right? And so, plopped down the down payment, was ready for the program. And I remember day one, it was in person. And Linda Smith, who started the program, was still teaching at that point. And so I'm there like, okay, my little binder, notebook. I'm like, okay, let's do this, right? And she's like, start with a demo, what coaching is, so you guys can experience it. And my classmate went up, and he was a college student at the time. And she goes, okay, look at this wheel of health. What do you want to focus on? And he goes, well, I think I want to work on my spirituality. And Dr. Angela, I was in the back of the class. I was like, I mean, yeah, me too. But you have 20 minutes. What are you going to do with that? How are you going to teach someone? And then seeing, then seeing coaching happen in action. Like, what is your vision? What's it about? What does it mean to you? Well, I just came to school and kind of lonely. There's a Buddhist temple here, and it's about community and really connecting. And the more it went on, the more I still get goosebumps thinking about the day because it changed my life. I was like, wait, this is not teaching. This is cognitive behavioral neuroscience applied in real life.
That's right. That's right.
And this aha, I was like, this is what's missing in healthcare. We already know what to do. Yeah. People know that smoking cigarettes causes cancer since a long time ago. That's not the blockage of what, being healthy. Right. I say, if medicine's what to do, coaching is really the how and the why. And I realized, wait, this could be what can change healthcare in my lifetime. And I've done research before in the lab and primary care, and God bless researchers for the work they do of thankless work to just explore without knowing what's going to happen. And we need that. But I'll be frank with you, if we just focus all our attention on applying what we know, we could have a radically different healthcare landscape today or in our lifetime. And so ever since that day in 2018, I've been fully devoted to health coaching. I still teach at Duke University, and now I'm teaching with University of Houston. I've been working with the boards this year. Been really honored to work with them. And I'll kind of wrap that question up by saying this year, I worked with the boards on the Competency Ethics Committee up to the blueprint of what the materials for the programs that are accredited, also for the certifying exam. And went to Philadelphia, and I had this moment where I was like, wait a second. I was here 12 years ago taking my step exams for medicine. And here I am being able to help lay the foundation or continue the foundation that's already been started by people like Ruth Wolliver, who got some next to in these meetings, right? So long story long, that's how I found coaching very accidentally. I didn't know what it was, but I'm so glad that I had that first day in the training program.
And I think your aha moment is very similar to a lot of people that come out of the healthcare space. Man, I don't know how long you were there, but I always, when people say, well, were you in healthcare? I said, I did time for about 22 years, right? And so it was long enough, right? I was there. But you got to the same place where I got to, where the question always becomes, how are we adding value to our patients' experiences? And are we treating them a whole health viewpoint? And this is where coaching becomes so important. This is where the work of the health coaches becomes so pivotal when it comes to helping someone shift their life. So now you went through the program, you're now a board certified health coach. How do you see what you learned being able to add more value in a way that you may not have been able to as a medical doctor?
Yeah. A few ways, actually. So a lot of my friends who are still in medicine say, what do you love most about coaching? I say, one thing is the time I have with my clients. Right? I can have as much time as we need to take. But, right? So I have 90-minute sessions with some of my clients. I can be pretty long-winded. But beyond the time that we have, which is super important, it's the breadth of what we can talk about. In the clinic, it was like, well, here's this problem. Here's this lab value that we don't like because it's bad for your health. And what I was taught was tell the clients all the bad reasons, or patient, bad reasons why. Oh, you have diabetes, it's going to affect your eyes and your kidneys. And don't you want to feel your toes later on, right? But we never ask them why they want to be healthy. We just try to scare them why they shouldn't be unhealthy. And then it's so easy to be sitting there when someone comes in the ER and be like, oh, this person, they did it to themselves, or we're never addressing the root problem. Most of healthcare issues, the statistics show this, are due to behaviors. Most of the morbidity, mortality, and what we spend money on, it's not opinion, it's on behavior change. Even taking medication is a behavior, isn't it? Right? And so the ability to go beyond the problem, but really focus on the solution, and that's so individualized. So coming from a neuro background, I tell people, we have something like 100 billion neurons, give or take, can create something like 10 trillion synapses. So when I say that we're all different, I'm not just saying this as a kumbaya thing, just like mathematics. We are all a little different, but we all have similar things, right? If every brain is a vehicle. Most vehicles do what? They move through space and time. They have a way to steer. They propulsions, there's brakes. But some people are a car. Some people are airplane. Some people are a submarine. Some people are a bicycle. Right? And the job is to now the client to be the expert in themselves. The medicine was very paternalistic. I am the provider. You are the patient. This is what you're doing. Coaching is this partnership. I say, I'm an expert in behavior change, but you're the expert yourself. There's no way I'm going to know you more than you know yourself. I'm not going to know your values more, or all these stories that made up your life fabric. And we all have values, but they're all different. We all have visions, and they're all different. So what do we take about what we know how brains generally work, but then really apply that N of one, right? Oh, the studies show this. Well, I'm not 1,000 people. I'm one person. It doesn't matter if 80% of people do this. I'm only one person. So it's really gets to that what medicine always talks about. We want individualized medicine. We want individualized medicine. And they say we're going to do more exams to make that, or more lab tests. Just ask the individual in front of them, because only they know if they're happy, if they're motivated. Especially working with mental health. I can't tell you if the PHQ or GAD-9 doesn't tell me the details of the nuance of what's going on. And and to be frank with you, one thing I was really impactful in the training for coaching was being a client of coaching.
Yeah.
On paper, like, reflection. Then you see, wait, this is so motivating. I don't feel like, oh God, I'm like, I can't wait to do that. And it's at that individual's pace, whatever pace it is, it's the right pace for them right now. Really meeting where they're at. And I guess I'll conclude that question with something that attending of mine said one time that I just thought of related to coaching. He says, Diego, kids don't read the books we write about them. And I think that points out that the clients, they have they know more than any study before we met them. And it's that real personalized approach that I don't know what the plan's going to be until I meet someone, because how can I make a personalized plan if I haven't met you yet? And so I think that's where coaching really the paradigm shift is so different, which is why it's so effective. The old way wasn't working. So we got to find this new way forward.
That's right. And I think one of the things that people found to be very true, but even more so with the inception of the pandemic, and now that we're thankfully on the side of the majority of it, right? There's still cases and things popping up, but for the most part, we're over the hump. But one of the things that they found was that they need individualized care, and they needed it. They need it so much more now, I think, than ever before. And whether that individualized care was preventative care, whether it was care for specific chronic conditions, it's important that they have someone that can devise a plan, and they have the training to be able to do that when it's time to do that. And so to me, that is what gives this amazing value-based care that we talk about. But I'd love for like you to take an opportunity from your perspective to define what you feel whole health is to you.
Yeah, I'm glad you asked that, because it's one thing I was going to add to, as you were mentioning that, add to the question, is that one thing besides coaching is not just focus on one part, it's how the whole system comes together, right? And so inevitably we work with a client, they often come with one reason, but I tell some people, listen, the whole work life and home life, it's the same group of cells that are affected, right? And so we can't do this artificial separation, right? And oftentimes in healthcare, it's this one area. I'm looking at endocrinology, nephrology, cardiology. I liked general because I could put them all together. Because I remember seeing the cardiologist fight, oh, this medication is bad for the heart. This is bad for the kidneys.
Mhm.
I'm like, guess what? The patient has both.
Mhm.
We got to figure something out and put it together. And what coach is nice, it's not only the whole person, but also the whole person disease or prevention of disease. You don't have to have something wrong with you to want to improve on your health. You can also create health neogenesis. And I think we often in our personal lives can think of examples when we felt the gears are at a grind. Oh man, just work is going tough, got fired. My personal life is not going well. I'm fighting my family. It's like, just not going well. It just shows that it's all correlated. It all affects each other. But the good news means that if it all affects each other, we can also start
Yeah.
with any one area to create a positive cascade as well.
Mhm.
Things may serve us in one time, right?
That's right.
Things may serve us for study skills in high school. They're different study skills in college or med school. Was it good or bad? It just doesn't serve us now anymore. So really this idea that the holistic
Yeah.
health is the sum, what's it saying? The sum is more than, the whole is more than some of the parts. How you feel is more than just a few things checked off. It's how it
Yeah.
all integrates and come together. Your hope for the vision forward. So it's really not only where you're at, but where you're working towards. And if you can see that you can see a hope forward, that feeling of hope, that well-being is not just the lack of disease. Being
Mhm.
out of hospital, life is more than just not being in the hospital bed. It's more. How about we take that language
Yeah.
and make it a feeling of fulfillment instead? And
Yeah.
I guess I'll summarize at the end that saying each person defines that for themselves. Only you know when you're feeling in that higher vibrancy, when you're your best self. And so it's really how it all comes together. And that stability, that is a process, not an outcome too, I've learned, right? I thought, I'll be healthy, I'll be good. And then X, Y, and Z. No, life is stability is a
Yeah.
process. Think of balance when we're falling over or balancing around the whole time. So I don't know if that answered that question, but it's a beautiful question.
Absolutely. Yeah. So definitely answers the question about whole health. And my hope is that it gives the viewers another perspective or another way to look at themselves and then seek out the resources that they need to pursue whole health. And I think that's where Vibely comes in, right? And so I'd like to shift the conversation to Vibely and some of the amazing things that you've been able to be a co-founder and be part of in providing access to coaching and providing access to value-based care, or the way we like to look at things from a value-based model, and allow those individuals who may not have known whole health was what they were looking for all this time, but now there are a number of platforms out there, but each one of the platforms is unique and it's about finding one that fits. So I want to kind of shift gears towards, how did you get involved, or how did you get to where we now have this platform like Vibely, right? Can we talk about that a little bit?
Yeah, definitely. So last week or 2 weeks ago, I had a podcast with my co-founders, and briefly the story. I think it's a beautiful story of who we are as a company, because we all have the same value or the same vision forward. So everyone on the founding team is a coach or a client. It wasn't like, coaching is popular, let's do this. We've all been deeply transformed by coaching. And I got to meet my co-founder Jad. They basically found me, and they said, "Oh, Dr. Salina, she's still coaching. We're starting this new platform called Vibely. We'd love for you to be on." I said, "Hold the phone." Literally, I was like, "I have a question. Is there a health coach in leadership?" And I was like, "Because if not, I want to be that person, or I don't want to be involved. That person is there."
Yeah.
I've seen in healthcare what happens when people who've never been providers make choices for providers and patients. I've seen even other industry with coaching where people, they may be well intentioned, but if you've never done that experience, you don't know what you don't know. You don't know what it's like to be. And so
Nope.
I got to meet Jad, and he's a computer engineer, coder, brilliant mind, and heart of gold. He's a coaching heart. He's like, I want to make the world a better place through more human connection. And he told me something that I knew would be a good fit. I mean, many things, to be honest with you. He said, Dave, if we're going to do this company together, we got to make sure our values are really aligned, because we might make hard choices. We have to go back to our values. I was like, Jad, coaching is founded on vision and values. You best believe that's going to be our back. We wrote our values separately, make sure we're not influencing each other. And he's like, what's your dream? I'm like, I want to make a better place. He's like, me too. Let's dream big. And he's like, so what are the problems that are facing? He's like, Diego, listen, I'm not a coach. I'm a client. I know what I want as a client perspective. I know how I want to be treated. I know how the kind of people I want to work with. He's like, but you're a coach. Let me know what you and your community need, and I can build it for you to make it easier. Because Dr. Angela, we see in healthcare, anyone who's worked in healthcare knows it's like living in the twilight zone. Out of healthcare, I have my cell phone that can do everything I want. Call a car to take me to the airport and find a new place to spend the weekend with and order some food there. All within 20 minutes. All of a sudden, you're in healthcare, you want to send a record, you have to fax records over. You can't search a PDF. When I was a resident, there's a statistic that first-year residents spend 70% of their time interfacing with an electronic medical record. That should be patient care, not computer data entry. So it felt really frustrating seeing the potential for technology to help healthcare. But in actuality, I feel like a twilight zone. I feel like you're being gaslit. Like, what do you mean? This is, I know it's possible. I know it's possible from this. Why is this EMR so difficult? And so I really want to change that. And I was like, we have an ability for technology to not be a barrier, but to lower barriers. And I'm very protective of coaching because I don't want to happen in healthcare happen in coaching. So I said, how do I empower coaches? And so one thing I want to do is, and I'm proud to say this, that we are the most affordable HIPAA compliant platform in the market. Privacy for clients and patients is important. And so based on those values, because someone said, oh, how's it so cheap? I go, it's not cheap. Look at our receipts. It's just, we want to make it affordable. Because I want to lower the barrier for people to become coaches, for people to work with coaches. So we can lower our overhead, right? And also want diversity in coaching. I mean that in every sense of the word. I've been fortunate to work for different companies, different providers, but sometimes what they try to do is they try to scale something, but you lose that magic, right? You can only have this long of a session, 15 minutes. I'm like, I do 90-minute sessions. Oh, you can't see adolescents, but I'm a pediatrician. Why can't I see people who are 17? I help them out. Their family thank me for that. Or their passion and creativity. Coaching being this model for transition transformation, there's so much creativity that coaches bring to the table. Their past background, that neuroscience, peds background, lived experience. And we all know that, think about your personal life. When you're passionate about something, you work the best. I stay up late working on Vibely because I'm passionate about changing the world. No one has to tell me to work on it harder. When I'm serving those families with newborns, they're going through possible hard diagnosis, the fire is here. And that fuels me to move forward. And so I think, how can I give solo coaches the resources of a company, all those, the security, the tools for the admins, everything, to make all stuff get out of the way so they can focus on that client work, spend more time with, and the creativity they bring to the table. I don't want to tell coaches how to work. I want to give them freedom to be flexible so that any kind of coach can work. And the things I've heard are so specific, but so wonderfully beautiful. And if we allow their passions and diversity, and I mean that again, that's the word, in content that they talk in language they speak in, different genders, different racial backgrounds, everything, we will just naturally mirror the diversity of populations that we're trying to serve. We don't all need to be the same coach. We don't need to scale that way. I want to scale, but maintain autonomy. And so my goal of Vibely is to give every coach, whether you're just starting off, you just took a program, maybe you work for a company, but you still want to have your side clients, or you just full-time solo coaching. Can that be a solo companion that takes care of all the tech stuff, your website, all those things, but also gives your client a better experience? Remember, Jad's a client, right? How can we give them better service so they have better transformation? So I think it involves supporting the coaches and supporting the clients. Those are both people we're serving.
I love it. I love it. And I love that Vibely is among some of the first applications to be in the market that offer coaching in this way. You know, there's still only a few of them out there that offer it, you know, in this way that gives tremendous value back. And so I would love to hear more about some of the successes that people are finding while using the platform, right? especially the coaches that are on the platform now, what are some of the successes that they are finding? Their ability to have kind of a seamless way to assist their clients, a platform that kind of does everything for them. Some
Yeah.
of the other, what are some of, especially like some challenges that resolve now that they're on this platform?
Yeah, yeah. So a few challenges, and people say, "Oh, in business, only solve one problem." Like, there's so many problems to solve. Let's solve them all. Let's not limit ourselves. So it depends on the kind of coach, what challenges they've have been bigger hurdles that we've lowered. So one has been just having your web presence. I know I've lost so many potential leads, and like Leslie said, the gift of coaching. I could have given the gift of coaching, but I didn't have my presence ready. I meet someone at an event, networking event, or through friends or a friend. What do you do? "Oh, I'm a coach." "Oh, that's great. What's your website?" It's like, "Oh, it's not there yet. My about me is not there. Oh, I'll send it later." Right? Not having, and I'll be frank with you. I've talked to a lot of coaches. Nowadays, people aren't just, "Oh, I found you randomly online by accident." It's not really how websites
Yeah,
are working nowadays. Yet, if you don't have it, you don't see professional. And I think that also affects people, particularly with less economic funds, because that overhead, that high overhead to do that, or to have a EMR that's really expensive and clunky and bulky, right? So now you can have your web presence available, ready to go, that you can set it up overnight in an hour, get ready. And if not, we'll help you out, because I've done that, because I don't want to, I want to help coaches the way I wish I was helped, right? I'm here to serve coaches the
yeah,
way they serve their clients. So now you can have a professional web presence that's not only your profile, but also everything you need to manage the practice. So it's like Psychology Today for coaching plus the EMR, all built into one. And
mhm,
everything we have, it's really simple to use. People have been praising the user interface. And the term vibely actually comes from a combination of vibrant and lively. We want
okay,
well-being not to be a chore, right? We want us to be a happy place that you're able to work with people. You're like excited to get better. So for the coaches, some coaches even said, "I've actually stopped paying for a website now, because I don't really, this solves that
mhm,
problem." Other coaches say, "I like my website because I do other things, but I have it as a link to my site now. So chat with me directly here, my HIPAA compliant chat." Right? A lot of coaches I talk to say, "Well, Diego, how do I talk to doctors? How do I want to talk to my local doctor to get them to refer clients to me, or my local provider?" If you say,
mhm.
"Hey, local provider, you can send your clients to my HIPAA compliant platform," that's a very different look than just give my own number. I believe in the
That's
profession
right.
of coaching. And so I want to create a platform that elevates the profession of coaching, gives coaches a professional appearance and the professional tools they deserve as well, that their clients deserve. And I use this with my clients. They've given me feedback that I've incorporated into this. So another example is our session notes, right? So our session notes, the coach has a private note. There's a shareable note for the client. You can put links in that notes. You can, create your action steps, and the clients have a note they can share with the coach. We want them to be engaged during their journey. What are your takeaways? What do you think between sessions? Right? Um, and to me, HIPAA compliance, I have some coaches who say, "Well, I do leadership coaching. I don't health coaching. I don't need HIPAA compliance." I say, doesn't everyone deserve
Mm,
privacy?
that's
Regardless of the
right.
topic,
Mhm,
right? Because think about it, if you were
mhm.
asking someone to be fully authentic, fully themselves, be fully vulnerable in front of you, shouldn't they trust they're not going to add about what you talked about in session, or they sent you a
That's
chat
right.
message? There's sensitive
Yeah,
topics
privacy
people.
is important. Yeah, privacy is so, so, so important. And I'm glad that your platform has incorporated that from the beginning, because I know that when it comes to, coaches who work with individuals in state programs, federal programs, number one thing on the list is, how are you dealing with personal information?
Yeah.
Right? How are you handling anything that is shared about a person's, anything that's personally identifiable, and anything that has to do specifically with their health, the information of their health, which these things are typically shared for coaching. So these platforms must have that. And for those individuals who are out there who are coaching without the umbrella of some kind of platform like this, in this day and age, they got one. They've got to,
They've
because
got.
like you said, it's very different from, hey, I meet you at a conference. You think I'm a great fit as a coach. Here's my number. There's no real privacy in the information that's being shared back and forth, whether it's through email, that information can be handled any number of ways, right? And so it's important that they're on some kind of platform like this if they're gonna, coach. And it takes the guesswork out of, where am I gonna send everyone? It takes the work out of that. And I tell you personally, having graduated from a health coaching program in 2014 and started coaching in 2015, I can tell you that trying to put all those pieces together is almost, right? And so it's great to be able to have some place that people can automatically go and connect with you and book their sessions and get their notes and follow through from beginning to end of how the coach interacts with their patient or client. It's brilliant.
Yeah, Dr. Angela, something all these programs, I teach and we talk about HIPAA compliance. We don't give them tools on how to do that. Like you said, your texts are not HIPAA compliant. Here's your email. And if you have two different softwares HIPAA compliant, once you transformation between them, that transfer is not HIPAA compliant. Right. And so not only can we be more secure now, but I'll be frank with you, it can be more affordable because it's all in one. And one benefit I've seen personally, and Coach has mentioned to me, the work-life balance for myself. Now I know my work is within my platform. I'm not worrying my text or my friends to call me, not a client asking to reschedule. Right? Like it just, the work-life balance, which I'm a very big proponent of, is another benefit. Lower your overhead, give a better experience. And if you have more resources for yourself energetically, you're going to be more, oh my God, where to do everything. And the idea is also the platform can grow with you. So we're building technology. We started with first HIPAA compliance, and we actually have a HIPAA compliant website, trust.vitally.io, where you can see every hour a company checks our servers, make sure we're up to date. This is not just a one-time thing. We're continually being monitored, right? Trust, transparency creates trust. And not only, you mentioned if you meet someone too, there's a lot also neuroscience built into our technology, right? So we know there's more time between thought and action, more in action. So now when you meet that person who says, oh yeah, I'd love to work with you, you can say, hold on, give me a second, give me your email right now, and I'll invite you with a personal link to my HIPAA compliant platform.
That's right.
So now when they're ready, you are ready with your phone. What's your email? Check your inbox right now. Here's the link, and we're linked already. You can chat me wherever you want. You can share your Vitally profile with your friends and family. They can message me directly. All right. So how can we make the technology make more human connection, not less human connection, and make it also just easier, more affordable? And one more thing about technology. I'm also excited where we're going with this. So we did HIPAA compliance as that foundation. So everything we built that I'm going to explain is HIPAA compliant. So we're looking now at AI, but never to replace a coach. I want to be very clear about this. There are some companies saying, oh, we're going to use AI health coaches to replace coaches. There's a lot of studies showing this doesn't work, but I'm going to simplify for everyone listening. Think about your own personal experience. If you just lost someone, you're talking to, and do you want to talk to a computer or a coach? If you're going through cancer treatment, do you want to talk to a computer or a person? We are carbon-based beings that are motivated by interacting with other brains. Just a fact. So how can we use AI to support the connection, not replace it? So one thing a lot of students and even coaches I work with say, oh, my notes takes me so much time and I'm looking down. So we're developing an AI note taker, HIPAA compliant, can sit in session with you. And so when you're done, your notes are done for you and you're focusing your whole time there. We're using AI to kind of amass a resource library of health and well-being information, personal development. And now these AIs can talk to each other. They can recommend stuff from the AI library based off the notes that were taken and happened in session. And for coaches listening to this platform, to the podcast, I'm an educator. I'm always trying to work on my own coaching. I shared before we started actually with everyone, one thing I'm always working on in my practice is slowing down and talking less. Pause. I have a little picture of a dog paw on my computer screen. So now we can, it's just being real, right? But So now we can use AI to also help us give more honest assessments of our own skill set. Oh, I saw in session I talked 50% of the time, and so did the client. Oof, that's a data point. I should be talking less, actually. Maybe I'm working on using
Mhm.
less close-ended questions. I can ask the AI, how many closed open-ended questions? Oh, how many times does it use the word good or bad or use judgment words? So not only can AI give
Mm.
us more streamlined workflow, more time with our clients directly and focusing attention on them, but then afterwards, more tools to make sure, as our code of ethics says, that we keep up to date and are constantly improving. If we're asking our clients to improve, we're the first client, first and foremost.
I love it. I love it. And I know that when it comes to coaching and when it comes to helping clients remain compliant and on their on track with their goals, it's important that they get interaction from a human. Now, I don't know about everyone else. You know, I don't even like AI like when I know to like the first the next word is going to be representative, like somebody to talk to. You know,
Yeah.
so talk speak less about wanting a real human when it comes to my physical body and goals that I have for myself. You know, so so those things are so important. So it can never replace. You know, it can triage, it can provide data, it can streamline, and we do need to be able to do all of these things. However, when it comes to, you know, giving the right kinds of questions, receiving the right kind of information, and then teaching that client or that patient to remain compliant and on track with their goals, trust me, they need a person, right? We all are going to want some form of a human, um, unless AI gets so sophisticated, which I don't see that happening for a while, to
Yeah.
where it's emotionally intelligent. It's like it checks all the boxes to where you can't tell the difference between a human being and speaking to, you know, something other than a real person. And so I love that we have streamlined the process of connecting the client to the practitioner. I'd like to kind of shift gears, to talk about some of, you know, and these are probably, you know, some of the reasons. I know I have many reasons for stepping into health coaching and out of, not out of healthcare, but into health coaching and away from the bedside, I'll say.
Mhm.
And one of the things that really got to me was the rise in chronic disease, along with the rise in things like nosocomial infections, right? Infections around. I just got it because I happen to be a patient here. You know, I
Mhm.
otherwise wasn't sick with that thing. And so then it raises the question of, well, how can we have prevented all of this by providing some form of preventative care from the beginning? And so I know that Valley exists to assist with health coaching and assist with coaching and streamlining that process. But I'd love to talk a little bit about how you feel it will be beneficial to decreasing the number of individuals that have chronic diseases, or getting to a place where it can begin to provide enough preventative care to where, you know, we start to see those numbers kind of go down and things turn around. um, and then maybe later on in our conversation, I'd love to get into kind of the equitability or the equitable coaching that this platform provides for, you know, many different minorities, right? So those that are marginalized, like seniors, people in LGBTQIA plus communities, people who are minorities like us. You know, how does this give access to what it is that we need, and especially men? A lot of times I think men get overlooked when it comes to health and wellness, and we just say, ah, well, he's being non-compliant, and
Mm.
it just may be that he's not matched with the proper person. So
Yeah.
I kind of want to shift gears into that. But first, I want to talk a little bit about how you and the amazing people at Vibely see how it can be a staple in reducing chronic disease or being a big part of how these are managed going forward.
Yeah, and I'm definitely excited to get that second question, but so that's the first one first. So, like I said earlier, most of morbidity and mortality is due to behavior change, right? Look at our states, mostly things related to weight and its complications, diabetes, hypertension, cholesterol, but also mental health too.
Yeah.
Chronic stress, chronic depression, chronic anxiety. These things go hand in hand, right? And just looking at statistics, clearly, if most of our expenditure and morbidity mortality is on those things, we clearly haven't done a good job of it. The evidence was so robust, people would know it's why the national board exists, that this is the way to do it. And the way I explain from a neuroscience perspective is that if the brain takes time to change has to occur throughout time. So is a process of transition with someone through that change. Right? It takes time for those neurons to actually get a little closer together, form new receptors in the cell, be more sensitive to the neurotransmitters, etc. And when you allow change to be at someone's pace, it's sustainable change. That's the real difference. It's not a 30-day this, 40. People do 30-day diets. I go, are you planning to live more than 30 days? What's your plan for 30 days? What are you going to do? Right? And the coaching allows
Yeah.
someone to really be in control of their health and well-being, and particularly addresses those things that healthcare just doesn't address. So when I was working inpatient, I like the acuity of things. And okay, someone comes in with DKA, right? Diabetic ketoacidosis, emergency situation. All right, I can stabilize them by putting IV and do all this stuff. But then what's going to prevent them happening again? It's their lifestyle change,
Mhm.
taking the medication. It's just not what you do in the hospital setting. Even in the primary setting, you have 10 minutes. I think in all of med school and residency, I got a half-hour training on motivational interviewing. And by that, I mean a lecture. You cannot learn this through a PowerPoint slide. Right. And if you did, it would take much more than half an hour. So not knocking, because
Yeah.
we need acute care when someone is in these acute situations, but this is a different thing that's not addressed by traditional healthcare. So
Yes.
health coaching does specifically address what we know is the most common cause. And with Viably, you can have the autonomy of different practitioners to find what is your match. And people might think, what's your match based on the topic? Oh, I want to lose weight. I'm looking at this health coach who has a background in nutrition. Great. Oh, I'm looking for mental health. I'm working with Diego because he works with burnout. Okay. Like it allows you to look for the topics that you think that you need to address first and foremost, with a provider who understands that it is more about the holistic approach to
Mhm.
address that topic as well. And if you need
Right.
to, you can refer to a colleague more easily, right? It might take a village to do this. I've at times worked with more than one coach for different reasons because they had different specialties. Think of a hospital has a bunch of different doctors. You don't need them all to be the same, right? You
Mhm.
great to have a bunch of surgeons, but then what happens when you need an infectious disease doctor? You need a variety. So I want to have a variety of health coaches to again mirror that variety of expertise that our people are need help in. And that word non-compliance, I think, shouldn't even be a diagnosis in the ICD codes.
Mhm.
It's not. A lot of people would love to be able to be healthier. You tell a client, you think they
Yeah.
want to be in the hospital bed and be miserable and be there versus being with their kids or family? They're stressed. Or like, oh, but this person's smoking. I'm like, they're a single parent with 3 kids, not know where they're going to live. That's their only form of stress relief. Let's meet them where they're at and talk about how we can relieve their stress, not add more by chastising them because we don't understand what they're going through. So I think health coaching, particularly, and having the variety of
Yeah.
coaches available, you can find your coach. And we talk about the topic, but it's really important as a therapeutic alliance. Right? People say, I want a coach who looks like me, who speaks. I coach in Spanish.
Mhm.
It's not just the language or the cultural
Mhm.
understanding. If food's a really common issue related to health and well-being, I talk to these grandmas, but I show love through food. Well, how can we show that love in a way it's sustainable? You still get show love, but in a way it's healthy for you and the family, right? What are these different considerations and even if just having someone who looks like you, sounds like you, understands a similar path, if that lowers your barrier to getting help, because there's a lot of shame and guilt involved in getting help. And I'm and I will be if I've no personal experience. When I was a mess, I was like, oh, I know what depression, I know about anxiety. Yeah, it doesn't mean I wasn't really depressed during that time. People
Right.
talk to someone who
Yeah.
understands. Well, I talk to med students. They go, well, Theo, you get it. Like, yeah, we know the pressures of being on rounds. That's something me and that
Mhm.
client can particularly relate to. or the cultural consideration? So the answers are tied, but we'll pause because I think the other answer deserves a little bit more conversation, actually.
Absolutely. Yeah, no, I love that because, now that we have, the a means to stream access to a platform that will allow individuals who can provide value-based care to do so, the type and the quality of care that they're able to provide on that platform matters, right? And so, I love that the preventative approach to whole health is a part of Vibely. And so then we move to what we feel like is equitable access.
Mm.
So you're did an stream. We did an entire stream on the social health, how those affect minority populations. And so, I would love to talk a little bit about, the equitable access to diverse health coaches, and not just having someone that looks like us, culturally, racially, but also having people that identify um, with the same gender or the way that the person feels like or who they feel like they should be able to coach with or get support from. And that's so important because we can compile all the resources in the world. That's like in the example with the parent who smokes, which is excellent analogy, by the way. You know, we can compile all the resources in the world showing them how smoking cessation is a viable path for them. But if it's not in the language they speak, if it doesn't make great financial sense for them, how are we equitably meeting them where they are? You know, and we see this a lot in the health coaching, especially in the health coaching industry. So I'd love to hear more about um, how Vibely, either now or in the near future, is putting things in place to make sure that this platform, if someone is seeking information on this platform, it's equitable, it's timely, it provides resources that meet them right where they are, and they can actually get the use out of it.
Yeah. This is a topic that's really dear to my heart, right? Like, I think we could have. I also would love to have another whole podcast related to this, right? Because when I was in medical school, I remember I did 5 trips abroad, to different orphanages, work in different countries. It was a little easier to get some donation funding there. But how do we make a system that can actually also improve beyond what's happening in the hospital, but to prevent people in the hospital? So one thing I'm trying to do with Viably is, again, just make
Mhm.
it easier for coaches to run their practice, so they're more likely to give that gift of coaching, like Leslie has said, right? So that if your overhead is lower, we can have more people who are underserved or not normally represented in coaching have a chance to be represented in coaching. Which what means that means that the clients, they go, I didn't know. Oh, well, if that person looks like me is getting coached, maybe it's not a bad thing. I think coaching does have a little less stigma than other forms of mental health. It's all a foot in the door. And you mentioned, different groups, including men. In coaching, there's not as many men. Everything else, I know we have way too much power. Let's be real about this, right? But when I get adolescent males to come to me, it's because they feel more comfortable with that. We need the diversity there, right? They understand what it's like to be Latino male, grow up with a Latino mom or Latino dad, and the expectations there, right? And that can be the same for um, any kind of a minority or even majority, right? We want people to understand that lived experience. So we can, one, lower the barrier by making it more affordable and not putting limits on who can use this, right? If you're a health coach or you're an ICF coach, you can use this platform to be the way that you think you should do. Because how can I tell, for example, Angela, how can I tell you how to work with African American females? That's not my role. Right? Like, it's not in the cards, but how can you give people the freedom to do that? And then what we're trying to do, and I'm glad you mentioned what's now in the future. I want anyone who's this podcast to be able to contact me, because there are so many more dreams in the future that I want community to be involved in. Part of Bible is we have a community of coaches. I hear coaches with amazing ideas, but they're kind of by themselves sometimes. I'm like, let's unify them and let's write a grant together. Let's do a research study together to help more funding here, right? Can we, for example, we actually had a little talk earlier about, insurance billing and health savings account. We're going to put on Vibely information about the health savings account so clients understand, oh, you can pay with this health savings account. I didn't know that. I know there's CPT codes for coaching. Now, we all know the reimbursement is a little hit or miss right now, but we are ready for when it's fully hit to be there. And also for those people who don't even coaching is real, if you see a CPT code, whether your insurance covers it or not, because of different insurance policies, you at least know there's legitimacy there. There's trust there. So it's another way some communities don't feel trust towards healthcare for different reasons, and some really important historical reasons why. Right. So can we lower that access? And one thing we even put, I eventually to me, I believe health is a right, not a privilege. And I don't want coaching to be by privilege for privilege. I want everyone represented in coaching. Right. And so that includes, for example, I know coaches who have different price points. They say, you know what, I'm retired. I want to help. This is my price point. I purposely want to be accessible. So we have, when clients come in, they can search by price point sensitivity. And one thing I'm going to share with you, hopefully my other co-founders don't get too mad at this, but I'm looking at ways, how can we also help people who are trying to give more pro bono or sliding scale sessions, right? Or how do we have group coaching in our platform that lowers the cost but increase the access, right? So if anyone listening to this has ideas or knows communities that are in need, contact me directly, because our marketplace now has the ability to search by price point. And I'm thinking about ways, I know all the people who want to help. Who needs help? I'll connect you guys. I'm not even for the money. I just want to help make people more connection. So to me, it's a well-being hub where people who want to give help and people who need help, and help maybe even too paternalistic, who want to be served or want to improve, right? Because you don't need to have a deficit in order to improve with coaching. That's what I really love about it. So I have many ideas for the future of how we can also scale that assistance. Right? How can we lower the price for both parties to make this easier to work at? And once we have more coverage, Vibely is ready. We're already figuring the back end. What can we do so that day one, boom, those providers who want to give can give the way they want to give in their private practice and serve those they want to serve in the way that they know how to serve best. It is really dear to my heart, and I really could talk for another hour about this, but I really want health in general is a right, not a privilege, and I believe that at my core.
I agree. I love it. And I always say health coaching is for everybody, every culture, everywhere, and it's just about having access to those resources and things that are out there. So I love that Vibely exists to do this, right? To move the needle on it. So in an ideal world, what would you like to see, or where would you like to see healthcare technology innovate healthcare in the future? What would you like to say? Man, it'd be great if I could wake up and healthcare would be like this. In an ideal world, how do you see, technology playing a role in that? What would you ideally like to see?
Yeah. Oh man, I got so excited thinking about that. Just, how do I choose only a few things? So I think one thing I'm trying to do is have healthcare is easily accessible the same way everything else use your phone is for, right? That you can have your healthcare companion or guide with resources or professionals easily linked together, right? Your insurance is already kind of inputted in there, or your cost is in there. So you can just search by what you need, not just by like, oh, let me go through a million pages to find who I need. We're lowering those barriers. And I want clients to be in control of their own data. A lot of these EMRs work by just kind of securing the data and then make you pay for your information. It's like, what? That's, to me, it's bonkers. I understand why. They make a lot of money doing it, but I wish that the information stay with the patient. So when they go to different providers, they can give you the record, which is you calling on the phone and scheduling and sending a fax, right? So as a provider, when someone comes to you, you can communicate them beforehand, during, and afterwards in a seamless way. Meet them where they're at. Think about how much technology has advanced for other forms of connection. Why can't I do this for healthcare? Take the complexity out of it, right? So imagine all your labs. Take a picture of them, and it's inside a summary. Here's a graph of the trends of this. The more important is the data. What does it mean to you? Hey, we noticed that during the seasonal change here. Did you notice that? What's happening in the wintertime? Oh, I'm more depressed because of here's some, and more connection, right? How can clients and patients also connect to each other to support each other? I really want a system where the primary goal is to help the client or the patient, which to me is you do that by also helping
Yeah.
who's providing the care, the doctor, the nurses, the health
Right.
coaches,
Yes.
right? That's who you're
Mhm.
serving, right? If you're having a restaurant, you got to make sure your chefs have the tools they need. And so not the other way around. Right
Yeah.
now, EMRs are like, well, you got to use it this way. Why don't you build it to us if we're the ones using it? So ideal world,
Right.
both the providers and the doctors have this easy technology that is also easy to integrate across different platforms, right? There's interoperability
Yeah.
is a term, right? They can talk to them more easily, right? Because there's no one platform for everything for one person, but how can that data, that information be easily transferred? So now we're taking away all the headache, all the time spent, all the find the data, so you can focus on what's important. And along that lines, I'd hope that would lower the cost of healthcare, and more money spent in healthcare would go towards patient care, to the people providing the care, not to the people in the
Yeah.
background. We need administrators, but we do not need 3,000% more administrators than providers.
Mhm. Yeah. 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 So I innovate how we do capital in healthcare, and put the resources towards making sure the practitioners have what they needed so that they can take that whole health approach. And you're right, build tech to what they say versus system, and here's what the numbers say, or here's what the data says. And it's like, we've got more burnout, and we've got people who are, what do you call it? What do you call it? Not like a high turnover rate, but people are always switching hospitals. They're always switching jobs. Providers jump around a lot. It's just what they do. So I love that. And so I want, before we go, I want to put kind of in the comments how people can contact you if they want information about Vibely, and how they can get connected to have a demo of it, whether they are a healthcare provider or health organization, or they are an actual coach, someone in the field already coaching and needs to streamline technology into their processes. And so while he's putting that in the comments, you guys, and make sure you put your socials there too, so they know how they follow you and things like that. So that if you put those, well,
Let's see. I got a few in there.
free,
So
awesome.
yeah, so
Yep, awesome, awesome.
Vibely.io.
Yep.
And then you can
So
email me directly, Diego at Vibely.io. Oh, sorry, Dr. Angela. Didn't mean to cut you off there. A little lag.
no, go ahead.
Yeah, so check out our site, Vibely.io. You can sign up for a free trial. We give everyone 30 days for free. And if you're a student enrolled in a national board approved program or ICE approved program, we'll give you 90 days for free. I'm a teacher, I teach at Duke University of Houston. I want students to make it. Start your profile right away. Don't wait till that you meet that client to have that profile done the next day. Have it done before you meet them. So 90 days are free for any student. On the bottom of the trial page, it says, "Are you a student?" Fill in the program you're in. We'll verify you in the program, and we'll give you 90 days for free. Everyone gets 30 days for free now, and the early adopters now, the next 300 coaches, will also get free month of the AI, which we're working on right now. There's AI note taking. I want people to know I'm here to serve coaches the same dedication and passion that you serve your clients, right? So I want feedback. I created this thinking about all kinds of coaches, but now I want all kinds of coaches to let us know what we're doing next, right? We're gonna have a product roadmap coming out soon. And within each profile, I'm actually really proud of this. Our co-founder, Jad, worked really hard for this. Um, each profile has a demo account built into it. You could click a demo account within 45 seconds. AI will spin up a bunch of fake clients. So you can see what it looks like to send a chat to your clients or reschedule, send them resources. And we even put things that we're working on in that demo account to get real-time feedback as we develop them. Again, we're listening to coaches to know how to build a coaching platform. We're not telling them what to do. We're here to serve you coaches. So join our community, join our forums, meet other providers, do referrals, and contact me directly. Every coach on our platform has a book a call with this feature. That's to my calendar. I want to hear from you. Demo it out, try it out, see what you love, what you don't love yet, and we'll make it happen. We're proud to say this is our minimal lovable product. This is just the beginning. The sky really is the limit. So we're here to listen and to serve.
I love it. I love it. Well, thank you so much for being on Evolution of Health Coaching. Truly, technology takes health coaching to a whole nother level. And I am grateful that we have a connection to Vibely. Like, we have this platform that is for all different kinds of reasons and different kinds of practitioners. And so it's been just an absolute pleasure having this conversation with you. We finally got it on the calendar, and I'm grateful that we did it. And so, what are some final words you'll have for people who are kind of on the fence about getting into something that would lead to value-based care? There may be a practitioner like you and I were, or like just trying to figure out how else they want to add value to their patients' lives. What would you say to them as we head out?
Yeah, I would say definitely give it a shot. I did not expect what coaching would be until you experienced it, right? So if you're not sure, at least find a coach. Talk to me directly. I'll help you give you a session. When you experience what it's like as a client, you're like, this is the missing link. And what's beautiful about these skill sets, and you can integrate them into your practice. I know a physician who does the last client patient of the day is coaching, right? These skill sets can not only work for your professional life, but also your personal life. It will make you a better person. It will make you feel better. So explore with curiosity and have fun doing it. There's plenty of people out there who would welcome you with open arms to the community.
Awesome. Well, thank you again, Dr. Salina. And thank you, everyone who shared time and space with us. We'll see you guys next week. Bye-bye.
Thank you, Dr. Angela. Real pleasure. A real honor to be here with you. Really appreciate it.